So you'll see things where you'll think this is eczema. You'll make that diagnosis, you'll treat it as eczema and it won't get better. So then you've got to ask yourself, why isn't it getting better? The commonest reason for a rash, just like anything in medicine, not to get better, is not that you've chosen the wrong treatment, it's that you've made the wrong diagnosis. So if you've made a diagnosis, instituted treatment, no response, rethink your diagnosis. So the common things I see, for instance, the person who has a spongiotic drug eruption where they've made a diagnosis of an endogenous dermatitis, they haven't looked into the drug history, they haven't recognised that 3 weeks before this rash came on, they were started on a new non-steroidal, and that's the cause of their problem. If someone comes in with a unilateral eczematous eruption, so the classic red scaly hand or red scaly foot, people make the diagnosis of eczema. They might think, oh, it's a contact dermatitis, or it's an irritant dermatitis, or it's an atopic dermatitis. They'll start them on treatment, they don't get better, or they get better a reasonable amount and then it recurs. If it's unilateral, that's a bit odd. You don't normally get a unilateral contact dermatitis with hands and feet. You don't normally get a unilateral endogenous dermatitis like atopic dermatitis. If it's unilateral, think about infection. The classic infection to mimic an eczema is tinea. So the red scaly hand, one hand affected, think tinea. Two hands affected can be tinea too. Another reason that an eczematous eruption, another thing that we see is an eczematous eruption that is due to infection. It's called an infective dermatitis. And in those patients, they get a superficial staphylococcal infection in the skin and they get an eczematous eruption, eczematous reaction to that. And the treatment for that, if you just give them topical steroids and don't address the infection, it's always going to keep coming back. So you've got to give them, you've got to take a swab, put them on oral antibiotics and get rid of, maybe some topical mupirocin and get rid of the infection as well. Another reason that you've made the diagnosis of eczema and they aren't getting better is you haven't addressed the coexistent factors of secondary infection, you haven't got rid of their dry skin, you haven't got rid of the exacerbants, the classic thing being hand dermatitis with hand washing, etc. Another common reason for them not to get better is the people who have lower limb eczema. There's a very well-known entity that I'm sure you've all seen called venous insufficiency dermatitis, and they're the people who have background varicose veins, and they'll get this bad eczematous eruption. It'll often be a weeping mess. It often gets misdiagnosed as cellulitis, but it's not cellulitis because it's bilateral. They're not sick with it. They don't have a fever. It's not tender. They don't respond to oral antibiotics. They then twig and they think, oh no, this is venous insufficiency dermatitis. They treat it as an eczema, as a dermatitis with topical steroids, but they still don't get better. And that's because you have to address the background varicosities and or the background peripheral edema. Lower limb eczema, or dermatitis or even psoriasis, if they've got peripheral edema, addressing that will go a long way to getting their dermatitis to get better. So you've got to look for, exclude and remove exacerbating factors. Other conditions that can mimic a simple eczema, the autoimmune blistering disorders can do that. For instance, I've got beautiful photos of a little child who came in with what I thought was dermatitis herpetiformis, with little papulovesicles on the elbows and knees, the classic distribution. But when we biopsied it, it showed spongiotic vesicles with lots of eosinophils in it and very suggestive of insect bite reactions. And when I rang the mother up, after telling her I thought her child had dermatitis herpetiformis, she then informed me that the house had a big flea infestation, and so these things were almost certainly flea bites. So readdress your diagnosis if the patient isn't getting better.